We're going to look now at the structures of the basal ganglia. I've taken a 15-part brain model and removed all of the cortical structures, removed the cerebellum, and what we have is essentially brainstem, diencephalon, basal ganglia structures, and some insular cortex here. If I remove the insular cortex, just put that off to the side, I can more clearly see the structures of the basal ganglia. So we're going to look from this side of the brainstem. And what we see here laterally is the putamen and the caudate nucleus. And you can see the head, body, and tail of the caudate. You can see that C-shaped structure that we talked about in lecture. You also can see the tissue bridges that join the caudate nucleus with the putamen. So what I have here with the caudate and the putamen, this structure is the striatum. And you can see that striated look that is caused by those tissue bridges. If I look medially, medial to those basal ganglia structures, I can see the thalamus posteriorly. So all of this is thalamus right here. On the other side of the model, I have a little bit different look. So laterally, I have, again, the putamen. The caudate nucleus is medial, so I can see the head, body, and tail of the caudate wrapping all the way around. And in between the caudate and the putamen, I see fibers on this model running from the cerebrum down to the brainstem. Right here, these fibers are actually corona radiata. But if I could remove the putamen, which I can on this model, and I look deep to that, I can see the internal capsule. So all of these are fibers of the internal capsule. Anteriorly, this is the anterior aspect of the brain. So this anterior portion is the anterior limb. This posterior portion represents the posterior limb. And then right where the pin is the most medial portion of the capsule. And if you look at it from the top, you can tell that it is the most medial, and there is a bend there. So this is the genu, right in that deepest, most medial portion there. That's the genu of the internal capsule, right there. Now, lateral to the internal capsule, I have some structures of the basal ganglia. I have the putamen most laterally. Put this back in here so you can see it better. So the most lateral aspect here is the putamen. And if I were to take this out and look medial to it, turn it over, medially, a little bit different color here, this medial structure is the globus pallidus. So you can see that together, these two structures look a little bit like a bean or a lentil, and this is the lentiform nucleus. So putamen laterally, globus pallidus medially, there's your lentiform nucleus. Anatomical name, but not functionally the same structure. Now, if we go back and look at the brainstem, put all of our structures back, and we go back and look, you can see that. Remember that the internal capsule is down deep to this putamen globus pallidus. If I'm anterior in the brain, then between the anterior limb of the internal capsule, medial to that is the caudate, lateral to the anterior limb is the putamen and globus pallidus. If I'm posterior in the brain, my medial structure is going to be the thalamus. So medial to the posterior limb of the internal capsule is the thalamus, and lateral to that is, again, the putamen and globus pallidus.